is very, very common. When I asked all you wonderful humans to list what your chief concerns that your patients have, the number one thing that kind of popped out and somebody said was tired. I'm tired. This is very common. I'm burnt out. I'm tired. I'm just really freaking tired. Guess what happens when you give somebody acupuncture? They get more tired. So I warn patients, and I tell them this little story, because we learn through stories, and if you tell them, be like, hey, you're going to be more tired. It's like, cool, and that's for them. So I tell them, I say, listen, when I treat patients who are burnt out when they're tired, what they usually do is they come back a week later and they say, I hate you. I say, why do you hate me? And I literally had this happen early on in my practice. I'm like, I hate you. I thought I was here so that you could make me feel better. I thought I was here so I would have more energy. But what the heck's going on? Man, I can't stay awake. I can't stay awake till midnight. I'm going to bed at 9. Okay? How's your sleep? I sleep through the night. and I wake up and I'm still a little tired. But then the next day it's like I go to bed at 9 and I'm really, really thirsty and I'm drinking a lot of water. And I'm really hungry and I'm craving foods that have water. And I'm like, oh, okay, this is cool. Just come for like a couple more shirts. And then they come and the same thing happens. Imagine what that looks like. You drink water, you eat foods that have water, and you go to bed at 9 for 7 days a week for 3 weeks straight. Finally, they come in after like the 3rd treatment and they go, fantastic, I have a lot of energy. So this is kind of a funny thing, but I want to be able to tell you so that we can communicate with our patients better. So I tell them that story and they go, ha ha ha, and then it happens to them and they're like, they come in after the first week and they're like, I hate you. And I'm like, told you. So, the other thing in terms of energy and a caution is, especially when I kind of like demo treating this acupuncture spot here, and just in general, like when you give somebody acupuncture, it seems to affect the motion. You've probably experienced this yourself. We're in clinic where you needle, and it's like, and somebody gets dizzy right away. You put needles in, and they're like, oh my gosh, I'm dizzy. And so you talk them down off that ledge, because what ends up happening is they start spinning out of control, and they're like, oh my gosh, I'm dizzy, and then they worry about being dizzy and feeling nauseous, and then, you know, that could lead them to pass out. I've had nobody pass out in my clinic. I talk them down off that ledge. But what ends up happening is usually blood sugar issue. So something that you can communicate to patients is, hey, make sure that you eat something within an hour of your treatment. I once did, I was at a wellness fair, and I gave acupuncture to, I don't know, 8 people or whatever, and there was a young teenage girl, pale, a little kind of like, use the word emaciated, but kind of looked deficient, looked cold, you know, kind of thing. And so I'm giving them all treatment, very basic treatment, you know, just like maybe like 24 yin tong, maybe ear shin man, and I don't know, PC6, LA force, just something just very calm. And I kind of start seeing her eyes kind of dart around, and automatically I'm like, you okay? And she's like, I don't feel good. So I take all the pins out, and I'm like, what's going on? She's like, I feel like I'm in a faint. So this is at like 2 p.m. in the afternoon. I said, so when's the last time you ate? She's like, I said, do you have breakfast? She's like, yeah, I had breakfast. I said, what time do you have breakfast? She's like, oh, like 10 a.m. I'm like, I guess that's so bad. So what'd you have? I said, a yogurt. I said, did you have anything else? No, I had a yogurt. I was like, crap. So anyways, there was this big spread, and I picked her up, and I'm like, and I started like shoving food in her hands. And I'm like, start eating. So she starts eating, and of course. So just so you know, so 2 things, blood sugar can drop. So if they're not having food soon, you know, maybe ask them to have a little bit of food, and just be able to tell patients that, as I say, if they come in and they're tired, they're going to be fully tired.